Hello and good day to you, everybody. Good morning, maybe, who is here with us in Singapore, or good evening, depending on where you are in the world. Welcome to our session, to the third and final day of the conference on integrative medicine. It is my absolute honor and pleasure to welcome you, Dr. Lorenzo. Thank you so much for making the time for this conference, for this event, to share your knowledge, to share your research findings, and to later on in the session to also answer the questions that our audience has for us. Let me just briefly introduce the doctor to our attendees. He's a distinguished professor in clinical cancer prevention, and he's also the director of the Integrative Medicine program at the University of Texas Anderson Cancer Center. Dr. Cohen has also done some work in China. He's a founding member and the past president of the Society for Integrative Oncology and the former vice chair of the Academic Consortium for Integrative Medicine and Health. Today, Dr. Lorenzo Cohen's presentation will be on yoga as a way to transform your life and health, and I'm sure we will all benefit from it greatly. Please give a round of applause to Dr. Cohen.
Great, thank you. Before I start sharing my slides, I just want to thank the organizers and for all of you in the East for waking up so early, and those of you in the West for staying up late, particularly for those in Europe. I don't have the best lighting at the moment because I actually happen to be up at a cabin where we don't have very much electricity, so kind of mounted two flashlights above a mirror here. This is a place called Georgian Bay, and I thought if we can still see outside because it's dark, just show you a quick look at what I get to look at while I'm giving my talk. This is what's out over my shoulder. This is where I come every year, where normally I'm here for 2 weeks with no work, with no cell phone. My colleagues at first didn't believe me that I wasn't going to look at email, but now after coming up here for close to 20 years, they know that I'm not reachable up here, but summer is over and I'm still up here. And so for me, one of the benefits of the world pandemic that we're all experiencing is that I can work from this beautiful location. So I hope that, and we can talk about this throughout the session this morning, that, you know, in addition to rising to the challenge and trying to do what we can in our own lives, to always also try and find something positive. And if we look deep and far enough, there's of course always something positive in any experience that we have. We can all learn, of course, from Viktor Frankl, who wrote the amazing book, Man's Search for Meaning, where even in his experience in the Auschwitz concentration camp, he was able to find meaning and purpose, and that helped him develop a whole new field within psychiatry in terms of learning and growing from trauma. So today, let me share my slides with you. I'm going to be talking, as was mentioned, about yoga as a way to transform your life and health. And here, when I'm talking about yoga and throughout the session, it's not just yoga as the way we think of it typically from the perspective of asana, pranayama, and meditation, and where in the West there's tended to be more of a focus on the physical side of yoga. But yoga really as a way of life. I wrote a book with my wife called Anti-Cancer Living that you see pictured here, and I'll touch on some of this at the end. But there's the focus here is, of course, on yoga as a way of life. And for those in, I think probably in Singapore, they're selling the this version, which is the British version. And then, of course, there's, oh, it's not pictured here, but there's also it's been translated into Mandarin as well as some other languages. But what we're talking about here is what we call the mix of six areas that are particularly relevant for preventing cancer and those with cancer to be able to improve not only quality of life, but also length of life. And the mix of six you see pictured here is social support, stress management, sleep, physical activity, diet, and reducing environmental toxins. And when we compartmentalize something like yoga, we would think of it just in the stress management component. But when we talk about yoga as a way of life, of course, it goes beyond just stress management. It goes beyond just helping somebody to relax. And it, of course, touches on all of the other aspects. So in this world of yoga and mind-body practices, there's been finally a strong recognition that there is an influence of the mind on the body. And a lot of the seminal work came out of, in particular, understanding the link between stress and the immune system. And the elegant work by Bob Ader and Nick Cohen out of the University of Rochester that showed back in the 70s that stress can be a conditioned response, meaning different psychological phenomena are associated with the control of the immune system, which meant that the immune system was not an autonomous system in the body, meaning separate from the function of other systems, which had been the prior belief. The immune system is the separate system, the endocrine system, the hormonal system, and it's all, we learned, interrelated. So we know that something like psychological stress can actually influence biological processes. And of course, this is one of the things that has brought people to the mind-body practices as a way of managing stress. But as we get further into some of the data and the research, of course, something like yoga is more than stress management. The stress response, you see here a pictorial representation of what the stress response is. And of course, it's first a assessment of our environment. And if we are experiencing something that causes undue harm or excess challenge that overwhelms our ability to have a healthy response, or loss or fear, we have what is called the fight or flight response. And there is this acute cascade starting, of course, in the brain down throughout the body of stress hormones, the release of ACTH, which leads to a release of cortisol, an increase in noradrenaline, adrenaline, or the American term for those, epinephrine and norepinephrine. And it's the release of these stress hormones that, in fact, is adaptive in the short run and allows us to mount this fight or flight response. And for an acute period of time, the fight or flight response is actually extremely adaptive. I argue that, you know, we've evolved from ancestors who had a very sensitive acute stress response. And they're the individuals who were able to fight or flee in a faster way than others. And they were able to procreate over the millennia. And so what has happened is that, you know, evolutionarily speaking, when we were hunter-gatherers, and in fact, that's for the vast majority of time that humans have been on the planet. And if you were to think about what that means, you know, if it's estimated that Homo sapiens is around 200,000 years or so, but it's hard to think about 200,000 years. But if we think of it in terms of 24 hours, that we were hunter-gatherers. Sorry, no, for 60 minutes, we were hunter-gatherers for 58 and a half of those minutes. So we've been an agricultural society only for about a minute and a half of the 60 minutes of humans being on the planet. And agricultural society is you know, starts around 10,000 years ago. So this modern society, and in particular after the Industrial Revolution, is just a fraction of a second of us being on this planet. And the changes, of course, since the Industrial Revolution, let alone even since the 1600s, is phenomenal. And so this acute stress response that was really adaptive when we were hunter-gatherers and even during the times of early agriculture is no longer adaptive when it becomes chronic. Sitting in traffic and having a fight or flight response is not only going to not help you get to work any faster, but it's going to harm your body. Having this acute fight or flight response when you're sitting there and trying to meet a deadline and staring at a computer isn't going to help you, because you have an increase in heart rate and blood pressure, you have a speeding up of blood clotting time, you have a suppression of the immune system, there's a shunting of the blood from internal organs into your muscles to allow you to run. And of course, there's no running going on. And of course, there's very little movement in our society at all compared to what it used to be, but that's another subject matter. So what used to be adaptive is now no longer adaptive. And we really need to start to harness this because the harms of chronic stress is hard to demonstrate in human models, but in animal models, and you see one example pictured here by my colleague Anil Sood, who did this elegant research that was published in Nature Medicine, was able to show if you expose an animal to stress, we see in this first set of graphs here, the tumor weight is much larger and the spread of the tumor throughout the body, which is the second graph there, is spreading throughout the body of the animals exposed to stress compared to the animals not exposed to stress that you see there on the first bar. Why this was such an important study was the understanding of the mechanism. So that last bar on both graphs are animals that were exposed to stress, but they had a drug on board called propranolol, which is a common medicine that a lot of people take for heart disease, high blood pressure, that blocks norepinephrine. You block the effects of norepinephrine, that stress hormone that's released, and the effects of stress totally disappear. So there's a lot of research, some of it from my laboratory, showing that stress can literally get into the nucleus of every single cell and have a negative effect. You see here the chromosomes on the end of every chromosome, lit up here in pink, is what's called the telomeres. And the telomeres are there to help maintain the structural integrity of the chromosome. And if as cells replicate, you actually get what's called chromosomal, you get telomere shortening. And when you get too much telomere shortening, you no longer have that pink cap, and then you get chromosomal instability. A good sort of metaphor for the telomere is the little plastic that's on the end of shoelaces, helping to maintain the structural integrity of the shoelace. As we age, we get telomere attrition. As cells replicate, you get telomere attrition. And what we now know is that stress can also lead to telomere attrition, independent of the aging process. So that suggests that stress is literally speeding the aging process. And some research that we've done in this study was with kidney cancer patients. We were able to show that not only were the patients who were the most depressed, which is one emotional response to chronic stress in one's life, the patients who were the most depressed didn't live as long. They also had a dysregulation of this hormone cortisol. And importantly, we were able to look at the patient's blood, comparing the most depressed to the least depressed, and we were able to see a modification in genes that were related to inflammation, immune response, and the negative regulation of programmed cell death, showing that these were being misregulated in the patients who were the most depressed. And we also looked specifically in the tumor microenvironment and found that the patients who were the most depressed had an increase in tumor-associated macrophages, and having an infiltration of macrophages and an increase in inflammation that you see in some of the other acronyms there that we don't go into the details of them, but essentially showing that the emotional depression was causing their tumor microenvironment to be more hospitable to cancer growth. In a separate paper in bladder cancer patients, we showed that the most depressed didn't live as long, and this was, again, independent of the stage of their disease. That prior study, they all had advanced disease, in fact. And here we showed the relationship with telomere attrition. The most depressed had shorter telomeres, the patients did not live as long. Now, on the flip side of this is some work that my colleague Susan Lukendorf did at the University of Iowa, actually showing that something like social support had a positive influence on survival. And here you see that the patients who had higher social attachment, better attached to people in their environment, lived significantly longer. And we see a different measure of biological functioning here, something called vascular endothelial growth factor, which is essentially a protein that is released by the tumor microenvironment, making it more vascular, meaning that the more VEGF that there is in the tumor microenvironment, the more blood vessels the cancer is able to form to feed itself. And a metaphor for this is like grapes on a vine. And the more vines you have that are able to feed the grapes, the more grapes you're going to have. And of course, in this analogy, the grapes are cancer. And the vines of the vascular system. So here we see that as social well-being, social support goes up, VEGF, this factor that helps cancer to grow, actually goes down. In separate research, and she's replicated this many times, and we've seen this association between psychosocial factors and survival in multiple cancers. This was ovarian cancer, and I showed you bladder cancer, kidney cancer. It's been shown in prostate cancer, lung cancer, breast cancer, that the lower the stress hormones, the lower the VEGF, the longer the telomeres, the better the patients are doing. And stress negatively influences these factors, and things like social support will positively influence them. So SNS here stands for sympathetic nervous system regulation, because that's really where it all starts, is with this initial stress response and then the cascade throughout the body, and essentially influencing all biological processes in our body. Everything that we've looked at, both in cancer and cardiovascular disease and other diseases, stress will negatively influence these different biological processes. When it comes to, I described for a lot of you in the non-science areas, some big terms. angiogenesis, which is related to vascular endothelial growth factor formation of new blood vessels, enabling replicative immortality. The fourth bullet down, that's when the cells do not undergo programmed cell death. The immune system, inflammation. What you see listed here, we're not going to go through all the details, are what are called the cancer hallmarks. These are biological processes where one or more of them need to be activated to allow a mutated cell to grow and thrive in the body. And we are constantly having cells mutate in our body due to just random chance when cells are replicating, due to short telomeres, which is what happens when cells replicate enough times. And there's all these things in place to ensure that that mutated cell dies, isn't able to replicate because it is not supposed to. Again, one or more of the cancer hallmarks needs to be activated to allow that mutated cell to turn into uncontrolled cell growth, which is essentially what cancer is, and to form a mass that we call cancer. Chronic stress activates all the cancer hallmarks. And this is now very clear across multiple studies, both preclinical and clinical models. So where are we in our world now? Well, we are experiencing a lot of distress. And interestingly, we are physically isolated from each other more so than before. What this interesting study did is it compared data from April to in 2018 to data from April in 2020, and this is in the United States. And in fact, the good news is that there was no difference in feelings of loneliness. So this concept of connection in virtual ways like we're doing today, it seems to have been effective. But symptoms of psychological distress are much higher. And there's certain groups, as you can see here, that are more vulnerable than others. On average, there's a 10% increase in psychological distress, and those of, in particular, the 18 to 29-year-olds and lower income. And you can see some of the other factors here in the United States leading to more psychological distress. This was a study that was actually just published this week that is from the same database and looking at the same kind of time period, 2017-18 compared to now, and in a measure of clinical depression, whether it's mild, moderate, or severe, and a clear increase in symptoms of clinical depression during this time. So we need to do something about this. We need to do something about the chronic stress that we are all experiencing. And those of you with families will read this prescription from the doctor and probably realize that, yes, I just need an easier job, a smaller house, and a different family, and everything would be so much less stressful. That, of course, is not something that we can prescribe to patients, but there are so many things that we can do. And from my perspective, these fall into an area that we call mind-body types of interventions. Some of those can be very conventional in nature, like cognitive behavioral therapy, different kinds of individual or group psychotherapy, different forms of relaxation, and then looking to the East, to a lot of the practices that have been part of other cultures for millennia, things like yoga, tai chi, qigong, meditation, etc. So I'm going to talk to you about yoga. Yoga came to me in my life when I was very young. This is a picture of my grandmother, Vanda Scaravelli, who started her yoga practice later in her life. She was in her 40s and then became very serious in her yoga practice in her 50s, and then throughout her life, she's, I don't know her exact age here, she's in her 80s when when she had these photographs done and wrote a spectacular book that I'll let you know about at the end. To tell you a bit about her background, she actually never went to India and said that India came to her, and her primary gurus fell into three different areas. She had somebody for the mind and the philosophy. She had somebody who focused more on body, and then somebody for breath. And so for her mind, her close friend, J. Krishnamurti, is somebody who she connected with and started on this, I guess you could say, more internal journey that she hadn't done up until that point. For body, she had daily lessons when B.K.S. Iyengar came to teach Krishnamurti. When Krishnamurti was done with his lessons, then Vanda would have her lessons, and you see here the very physical side of yoga. This is her on the left when she was much younger, and then in a yoga sleeping pose on the right. And for the breath, Desika Char, who really was, from her perspective, a master of the many different pranayamas. And of course, if we look at the full lineage here, this begins with Krishnamacharya, and of course, Desika Char being the son of Krishnamacharya, and B.K.S. Iyengar, the son-in-law. So yoga for me came through this tradition originally. And early on in arriving at MD Anderson, where I started research back in 1997, formed a collaboration with Vyasa out of Bangalore. And I know many of you in Singapore are familiar with the Vyasa organization, and some of the leaders who I know have visited on a regular basis. We've also been doing research with a different form of yoga, what we've called Tibetan yoga, some of these practices that come out of the Tibetan tradition. We've also researched Tai Chi and Qigong, and really all of these practices have the same overall goal, which is a calming of the mind, the union of the mind and body, and helping to connect mind, body, and prana, or Tibetan tradition, lung, to help with the flow of energy throughout the body. And we can get into the more esoteric aspects of outside the body and connection with the universe. We do this both with patients as well as caregivers, and as a unit, as the dyad, in particular the work of Catherine Milbury at MD Anderson. I'll show you an example of one of the studies that we did with the Vyasa group, and we have, as I mentioned, lots of past as well as ongoing studies that have been published. But this is an example of what we try and do, which is, in this case, it was breast cancer patients who were recruited around the time of starting radiotherapy. And they were randomized either to a yoga group, a stretching group, or to a control group. Importantly, and very rarely in yoga research, do we see what we would call an active control group. So the stretch group learns some gentle stretching exercises, in fact, the kinds of things that they should be doing to recover from the surgery that they had. And they received yoga twice a week for the 6 weeks of radiotherapy, and then we followed them at the end of treatment 1, 3, and 6 months later. So here we see a measure of physical functioning, and we're looking at change scores. So change from the time that they were starting radiotherapy. So a slight increase in physical functioning in both the yoga and the stretch group, but not meaningfully different than the control group. And where we see real differences is at the 1, 3, and 6 month time point, really favoring the yoga group. Little bit of an improvement in the stretch group, but not meaningfully different than the control group. except for that 3-month time point. But you could say it was almost a dose response effect. But again, much better if they were in the yoga group. Similar outcome measure of general health favoring just the yoga group. To me, probably one of the most important findings, this is measure of benefit finding back to Viktor Frankl and finding meaning in trauma. It's a measure of finding meaning in cancer, purpose and meaning in life, that the yoga group is maintaining higher levels than they did at baseline, even at the 6-month time point. And although they're going down slightly, nowhere near as much as the other two groups that are starting to drop off. So yoga in some way was helping people to make meaning and make sense out of this trauma that they were experiencing. So this is what's called cortisol rhythmicity. So this stress hormone called cortisol, you see pictured here at baseline, it's high in the morning and it drops throughout the course of the day. So I'm almost at the bottom there. And for those of you in Singapore and in the East, you're at the highest level right now. And a nice steep slope is actually very healthy and what we want to see throughout the course of the day. And in fact, we know that a blunted slope is a predictor of worse survival after breast cancer, as well as we published in kidney cancer and in other cancers. What we see here by the end of treatment is actually a blunting of the slope for everyone, but the yoga group was able to maintain the steepest slope. So we're seeing not only a benefit in terms of psychological well-being, physical functioning, but also maintaining better biological health. We wrote a review, this was now last year with Suzanne Danhauer and others, looking at all the research that's in particular been done in oncology for the use of yoga, either during treatment, like the study that I just described to you, or after patients are done with treatment and looking at survivorship. If you look at over time, the number of studies, and this hasn't been, the most recent data that we pulled was in 2017. The number of trials, of course, has gone up significantly. And these are randomized clinical trials. So there needs to be some kind of comparison group. And for both studies looking at yoga during treatment as well as post-treatment, clear benefits in the area of physical well-being, psychological and cognitive well-being, and in some cases, biological outcomes, as I described to you there, as well as some other studies looking at immune function. The data is becoming so good now on the role of yoga for cancer patients that it is now part of what's called the NCCN guidelines, the National Comprehensive Cancer Network, that's made up of the comprehensive cancer centers in the United States, of which MD Anderson is one, Memorial Sloan Kettering, Fred Hutch. There's over 50 comprehensive cancer centers, and they write guidelines for the types of chemotherapy that you give for this stage of disease or that stage of disease, the types of medications that you give. They have guidelines for surgical procedures, essentially everything to do with cancer. They have guidelines. They also have guidelines for symptom control that you see pictured here, anticipatory nausea and vomiting, or the treatment of nausea and vomiting, and you see pictured there yoga. Now they added the if approved by physicians, because there are of course some concerns for advanced cancer patients doing yoga poses that would put pressure on certain parts of the body if they have bone metastases, so they just wanted to err on the side of caution. You see there some other what we call these integrative medicine modalities, all being acknowledged as something that should be used to help treat nausea and vomiting. Acupuncture, acupressure, hypnosis, relaxation, guided imagery, etc. Here we see the newest guidelines for fatigue. yoga is listed here at level 1 evidence. And again, you know, the talk's not on integrative oncology in general, but many other interventions that are recommended for helping with cancer-related fatigue. Pain, we see a number of interventions, behavioral interventions, and of course overlapping with yoga would be some of these mindfulness-based practices, in particular meditation. ASCO's also, yeah.
Dr. Cohen, sorry to interrupt. I'm just letting you know that our next session should be starting soon for questions and answers.
Yeah, I'm just a few more slides, and
sorry. Yes, sure.
So more.
You know.
Thank you. American Society for Clinical Oncology, the #1 or oncology organization in the world, writing guidelines for the use of integrative medicine. They mention meditation and yoga for anxiety and stress, yoga for depression and mood, yoga to improve overall quality of life. You've probably seen a picture of this book cover before from other speakers throughout the session. This is a book that I had the honor of editing with Doctors Khalsa McCall and Tellis. And in fact, we are working on and having our first meeting this month to work on the new edition of this book. So just to kind of wrap things up here, what I've been talking about today, you know, again, primarily falls into this area. We think of stress management, but we're also doing research, and we know that our diet, our exercise habits also influence all of the cancer hallmarks and vulnerability to cancer, and influences outcomes after. And of course, primarily what we could call the sattvic diet, and in particular a yoga-based diet, would be primarily vegetarian and plant-centered and whole food. And this is really makes a tremendous difference. I'm not going to get into this, but maybe when the question and answers come up, we could get into more of this. In this comprehensive research that we're doing, what's quite interesting is that, you know, it's not only about the diet and exercise, but teaching people to be more mindful about their whole lives, and learning some simple asana, pranayama, meditation, but not with the goal of being better at your asana, prana, and meditation, but helping them to get somewhere deeper in their lives. And one of the patients encapsulates her sort of shift in her mindset, where she says that, you know, that for so many years, all her questions are trapped inside her, and she in some sense doesn't know the way forward. And she says through meditation and deep relaxation, her answers are now flowing. So in our book, Anti-Cancer Living, we talk about the synergy between these areas. Doing asana, pranayama, and meditation, absent from incorporating it into other aspects of your life, is better than not doing it at all. But it's really about all of these areas influencing each other. And of course, once we become more mindful through these initial practices, then we are going to be more sensitive to everything that is going on in our lives. And I call this, you know, yoga with a capital Y. And Vanda, in her book, Awakening the Spine, I think encapsulates this very well, and says that yoga, it's a living process that changes moment by moment, watching when we eat, how we eat, when we walk, how we walk, what we say, and how we say it. All these things are in us, and we must be passionately interested in them all. Thank you for joining this morning, and happy to answer questions that may have come up.
Thank you so much, Dr. Cohen. Thank you for this brilliant presentation. Um, very touching in a way. And somehow it felt very personal. We've already got a couple of questions here. I see some raised hands. Thank you for sharing your beautiful location with us. We all had had a chance to get a glimpse of your beautiful view. So Sophia Pang is asking, how about the lifestyle approach for children with cancer?
Two important issues. One is the fact that, you know, people younger and younger are getting cancer. In our comprehensive lifestyle study, we actually had a 24-year-old breast cancer patient, and you know, a friend of the family, a 30-year-old recently diagnosed with breast cancer. There's no question that the yogic way of life is going to be helpful for everybody. Most importantly, of course, for the prevention of cancer. But you know, for children, I think it's particularly important to be helping them to manage stress, to be eating a healthy diet, to be exercising. From a psychological perspective, it's interesting that, you know, children tend to adapt well. And it's often the young adults that have the most trouble. It's almost this bimodal distribution where the young and the elderly tend to have less stress, and it's middle age and younger age. But a child's body is exquisitely sensitive to these lifestyle factors. So it's very important for them to be managing stress, to be exercising, to be ensuring they're getting appropriate sleep, because their body will respond in a very positive way.
Okay, thank you, Doctor. Savita, would you like to go ahead and just unmute yourself and ask your question to Dr. Lorenzo, please?
Good morning, Dr. Lorenzo. My question is like for the parents who are residing in Singapore. Actually, it is for the children who are already stressed out because of the toughest education system over here. So would you like to recommend some kind of a lifestyle which they must follow in Singapore? Thank you.
The stress of school in general, is that?
It's the entire education system in Singapore is very tough, and many young learners are exposed to a huge variety of classes, and basically the entire day of a young child is studying 8 to 8.
Yeah, so you know, I think a lot of times what children are experiencing in the education system now, and we have two children who've graduated high school and are off in college, and one high schooler still in the house. And it's really unprecedented what we are expecting of them compared to, you know, when many of us went through elementary school and high school and college. And, you know, one, we need to be realistic, but it is unfortunately this kind of vicious cycle that, and the level of competition in the world, partly because of the number of people in the world now compared to 20 years ago. But an interesting reason why, and a pretty consistent reason why, and I'm sure it'll resonate with many of you on the call today, is that people will say, I don't have time. I don't have time to do yoga. I don't have time to meditate. And the reality is that one, it doesn't take that much time. Ideally, you know, we're engaging in a hour-long practice every day, but it doesn't need to be an hour long. And once you get into the habit and the practice of getting your mind and your body and into this what we could call altered state, the state of calm, this parasympathetic state of relaxation and better connection to self and others. Once you do that, and you do that consistently, then your body will go into that faster. So even in only a 10-minute pranayama or meditation, you'll be able to shift yourself into this more relaxed state. And doing that, it can be easier for individuals at different times throughout the day. So maybe 10 minutes in the morning, middle of the day, end of the day, to help take the stress off. And what you'll find relatively quickly is that, you know, at first you may feel anxious because you are not studying and you're taking time away from studying and you're sitting there doing nothing. And doing nothing is something that we as a world think is a big waste of time. But what you realize relatively quickly is that you're able to be more productive when you are working, that your mind is sharper. And the data is actually very clear on some great research, some of it done by Vyasa, some of it done by Satbir Khalsa at Harvard, as well as others, that educational achievements are actually higher for individuals who are practicing yoga or some other kind of mindfulness practice. And this was from randomized clinical trials, a great study that was done with medical students, and they were randomized either to, I think this one was a yoga group, an exercise group, or a control group. And the people who were randomized to the control group at first were really happy because they didn't have to, you know, waste their time every day doing yoga. But very quickly, they realized that they were missing out on something. And so there's something about the communion that comes from the students that were going to yoga class that had a beneficial effect on them psychologically. But most importantly was when it came to look at studying for exams, their ability to study for exams, and most importantly, the results, that there was better test scores for the individuals that were doing yoga. So, you know, this is something that, you know, I try and communicate certainly to my children and to my children's friends that, you know, this isn't just, you know, some, you know, Eastern way to relax and to become enlightened. This is going to help you be a better student. And so if they understand it from that perspective, they're going to grow new neurons, they're going to remember things better, clear data on meditation, increasing the size of the hippocampus. And the hippocampus is our memory center. So, you know, why wouldn't you want to increase the size of the hippocampus? And in fact, chronic stress decreases the size of the hippocampus. Chronic stress increases the size of the amygdala, the fight or flight center of the brain, which is going to flood your body with stress hormones, which is going to make it harder to remember things. So, you know, it's one thing to tell people. The people who really need to know and the people who really need to implement this is the educational system. So for all of you who are part of it, either as teachers or as parents or as young students, you need to start to bring this into the system, because we will only, you know, enrich ourselves as humans and not only manage stress, but the benefit will be, importantly, that people will be able to learn and retain knowledge better. So not decreasing the pressure on students, but allowing them a coping skill to rise to the challenges that we are putting upon them in our world.
Thank you, Dr. Cohen. Yes, this is definitely something that the Ministry of Education of Singapore can look into and hopefully integrate these practices into the education system. Okay, so let's see. Bhavna Mehta has also got a question.
Good morning, Dr. Lorenzo. It's a pleasure to be able to talk to you. So my question is about those who are already fighting the cancer. You know, they always fear about, once they are done with chemo and they move to targeted therapy, they always worry about the reoccurrence or the increased activity in the tumor cells, you know. So what are the chances even in spite of doing yoga and practicing and adapting other holistic ways of curing it, what are the chances, or what are the factors that influence the activity to increase, and how can we reduce those chances? Thank you, Doctor.
Yeah, thank you for that question. I could give a whole other lecture on the factors. Put simplistically, it's really the mix of six that we talk about in our book, Anti-Cancer Living. All of those mix of six: social support, connection to family and friends, managing your stress, getting an appropriate amount of sleep, eating a primarily plant-centered, low glycemic load, low processed food, diet, regular physical activity. These are really the key factors for helping to prevent cancer and increasing length of life after a diagnosis. The data is pretty overwhelming that the flip side of that, so being overweight or obese, being sedentary, sleeping less than 6 hours a night, eating a diet that's full of processed food, sugar, in particular red meat, those people have a much higher risk of developing cancer in the first place, and if they have cancer, worse outcomes. As I say all that, you could be somebody who is leading, let's call it the yogic way of life, a sattvic lifestyle, and you could still develop cancer. And once you develop cancer, you could change and start leading the more sattvic way of life, as I described it, and you may not overcome cancer. But when it comes to risk reduction and probabilities, the data is pretty overwhelming that those 6 factors are critically important. And we know that because they influence, again, one or more of the cancer hallmarks. Stress, diet, and exercise influence all the cancer hallmarks. And again, it's pretty clear that people who eat a healthful diet, exercise on a regular basis, and manage their stress, do better. And not only do they do better in terms of length of life, but their quality of life is tremendously better. So, that's, what one reason may be for health and length of life, but even more important than that is your quality of life. Having a horrible quality of life and living until you're 100 sounds a bit like a nightmare. So, we want to all seek to harness and boost our quality of life. And it's really through, I think, this yogic way of life that you've all been learning about these past few days.
Thank you. Thank you very much. I think it's one last question from the audience. Nazreen, would you step forward? Just unmute and go ahead with your question.
My question is about how much do you think diet actually plays a role in this entire lifestyle? Because studies have also shown there are people who are consistently consuming, having a very bad lifestyle, diet, but yet they live up to, way into a nice old age. So, and even smokers, people who smoke a lot, there are evidence also where there's no signs of any lung disease. So how much do you think diet actually plays a role in this? Or do you think it's more of a stress management that causes this? Thank you.
Thank you for that question. It's a good question, and it's hard to answer, but the reality is if you take 100 people and they smoke a pack a day for 30 years, yes, there will be some who don't develop cancer, but the majority will. You can take 100 people and have them eat red meat on a daily basis, And some of them won't develop cancer, but the majority of them will. So it's really all about risk reduction and probabilities. It's estimated that if we look at diet, exercise, weight, just those three factors, and within diet we include alcohol, because alcohol is a carcinogen directly linked with at least a dozen different cancers, that they influence risk of cancer, at least these factors, at least 50%. So that means that, are they, pure cause and effect? Well, not necessarily, but we know that your risk is going to be much lower if you lead and eat a primarily plant-based diet. But they're not independent of each other. And the problem is, in most of the literature out there, and what led us to write this book, is people look at them in isolation. And what we talk about is the mix of six and how they all influence each other. So the individual who eats, and there's some data for this, and we talk about it in our book, the individual who eats a healthy diet, but they're chronically stressed, they're not getting as beneficial effect from that food. And in fact, in some of the clinical trials, they showed that a stressed person eating a healthy diet, the body responds, at least from an inflammatory perspective, to the healthy food in the same way that a non-stressed person responds eating an unhealthy meal. So chronic stress really abrogates the effects of that healthy meal. So it's really about the synergy of all of them. But eating a primarily plant-centered whole food diet is critically important, not the least of which is all the researching. I could give a whole talk on this topic of the microbiome, which is the bacteria that, of course, are on and in us, and the majority of it being in our gut. And the only way to maintain a healthy gut is really through the food that we eat. With that said, the gut is also innervated by the brain, and there's a brain-gut connection. And so psychological factors are also influencing the health and well-being of our fellow travelers. And people who have a healthier gut microbiome have a lower probability of developing a number of different cancers. And importantly, after a diagnosis of cancer, response to treatment is also influenced by the gut, which is indirectly saying that what we eat is really going to matter and influence our risk of cancer as well as response to treatment. But we can't think of them, again, in isolation. It really needs to be this comprehensive approach. And, we can call it the mix of six, or we can call it, in the bigger way, yoga with a capital Y.
Thank you, Dr. Cohen. I think we will just wrap the session up. I just have one last question for you from myself, if you don't mind. When clinical trials take place and research on, you have data and at the end of it, certain recommendations. And as you mentioned, one of these recommendations is to incorporate yoga as exercise, say, as part of your life, at least, if you can't make it your entire life. And these recommendations are given to medical professionals. Am I correct?
Yeah, I mean, the
to encourage, yes.
That's right, to encourage their patient. Yeah.
So when these recommendations are given, I know that it takes some time from research and recommendations to reach the end point, right? Your target. So at this point in time today, how likely do you think these medical professionals are, these oncologists, these doctors who actually interact face-to-face with cancer patients, how likely are they to recommend these yoga interventions, and what is yoga to them?
Yeah, very complicated questions that are the first one it's hard. It's hard to get people to change. And in fact, the data around prescribing drugs suggests that even after a drug has been approved for a certain condition, it can take upwards to 15 years to change medical practice. And that's within the standard pharmacological world, which is the wheelhouse of the physician writing out a prescription and sending somebody to a pharmacy. Now we're talking about something like yoga, meditation, behavior, and these other factors. And you know, the research is being published in their journals, the Journal of Clinical Oncology, and presented at their meetings. So, and it's on their guidelines. You know, I've been at MD Anderson for over 20 years now, and I've seen a clear shift in attitude and in, let's call it, prescribing practices. But it's still going to take time. And at least in the United States, the most important way that it changes is if it's paid for. And of course, that's the case even in countries that have really good socialized medicine. It needs to be part of the system. Somebody needs to pay for it. And ideally, it's not out of the pocket of the patient. It needs to be part of the standard of care. So I think that we're not there yet. I think you'll be hearing from John Kepner shortly, and he can, in some sense, talk about some of the efforts that they're undergoing to try and incorporate this more. And part of that is, what is yoga, and who is a yoga therapist, and what's the difference between a yoga therapist and a yoga teacher. And John will, I think, share with you some of the work that they're doing in that area. There is some work being done through the WHO and the United Nations to try and not standardize yoga, but to come up with standards, so that, as you're asking, you know, what do people know of yoga? Well, they probably know very little beyond what they read or they see in their local gym, or hear about. And they often think about yoga as stretching and something physical. And a lot of people say, well, I can't do yoga, I'm not flexible. And of course, that has nothing to do with yoga and the purpose of yoga. So there's a lot of work to be done, but I think that work is being done. And hopefully there'll be a sort of logarithmic speeding up of all of this, and the integration of yoga and other forms of integrative medicine alongside not only cancer care, but medicine in general. I think there is much more acknowledgement of the role of lifestyle in medicine, both prevention and helping people to live longer and better even after a diagnosis of disease. An important factor is a whole new generation joining medicine who are exposed to this much more so than the older generation of doctors that are starting to retire. So I'm very optimistic about the future of medicine, and less of a reliance on pharmacological interventions that we know have their role and their importance, but also limitations, and needs to be approached not an either or, but an and doing more combination. And the more we combine, the better off patients will be, and the better off we'll be as a society. And there's no question that the majority of premature deaths that are happening in our world will be diminished if people engaged more in the yogic lifestyle. And, you know, last comment, and bring us back to the reality of what we're all living, some more than others. I'm currently in Canada because I have the luxury of being able to be here because my wife's Canadian, but I live in the United States, in Houston, that is not doing so well at the moment with this virus. What is the origins of this virus? Well, there's a lot of people who have crazy ideas about conspiracies, but the origins is, you know, our inappropriate treatment of animals. the origins of the majority of zootropic diseases, meaning these diseases that jump from animals to humans, is because our inappropriate treatment of animals. This was true of the last world pandemic in 1917-18, that actually they believe originated from the United States in the way that we are raising animals here. So SARS, this particular pandemic, the swine flu, H1N1 that Asia experienced a while ago, if we treated animals properly, we wouldn't be in the situation that we're in now. And I'm not saying everyone needs to become a vegetarian or a vegan, but we certainly wouldn't be in the world that we're in now if everyone was leading a yogic lifestyle.
Agree with you, could not agree more. Thank you so much, Doctor. We will see you later on during the panel discussion. It's been a pleasure. Thank you for your insightful talk, and we will see you later.